9 cases per 100,000. So glad to see that we are finally beginning to have a decline in numbers again, but it is still happening very slowly. So of course, the question that I've been asked is, will we make it to the orange tier before June 15th? And right now it does seem promising, but I don't know because it's still dependent on the blueprint, which is the state dashboard. And according to the blueprint, this week, the case rate for Sacramento County was at 7.3 per 100,000. And we need to get to below 6 in order to get to the orange tier. But we will continue to monitor that and still hold out hope that we will make it. Two other things that you'll probably ask questions about is, one is what's going to happen on June 15th. And when we get to that date, especially if we continue to see the continual decline in cases, as well as a reduction in cases in the hospital, that we will get to the point where we'll have what we're calling beyond the blueprint, where the blueprint with the tiers for each county, the colored tiers for the counties, and also the business sector-based guidance will all be retired. And in addition to that, the state order that pertains to that guidance, as well as the county health officer order, will be rescinded as well. We will still have the executive order at the state level. So there are still guidances that are connected to that, such as the masking. And then as far as the masking, one of the questions we've been asked a lot today is about the meaning of the announcement that was made by the Centers for Disease Control, that for people who are considered vaccinated and 2 weeks beyond their final dose, that they do not have to wear masks almost in any place unless they choose to. So before, they loosened it to allow them to be able to engage in activities outdoors. And now that's being extended to include indoor activities as well. That announcement was made today. The state has not updated their masking mandate. So that means that we have not been able to change our guidance either at the county level, but we're hoping that the changes will come soon. And usually we will be in line with what the CDC puts out. Also for the workplace, many workplaces are still under the Cal OSHA guidance. And so until that is changed, you will still have to abide by Cal OSHA. So you may need to still continue using a mask when you're in the workplace. Lastly, just wanted to let you know where we're at with vaccinations. We're at 1,123, oh, sorry, not 1,000, 1,123,175 doses that have been administered in Sacramento County. Last week, we administered 56,096 doses. We are at about 54.9% of the population over the age of 16 that have received at least one vaccine dose, and about 40% are fully vaccinated. And so with that, I would like to turn it over to Dr. Cohen.
Hi, everybody. Welcome back to another night of questions and answers. I'm Stuart Cohen. I'm one of the infectious diseases docs. I'm the chief over at UC Davis. I've been participating with this program for the last several months. I can't keep track of how many of these I've actually done at this point. But, you know, I think it's really important because we are moving forward and we want to give a perspective, not just from the health department side, but from what's going on in the community. And at UCD, we have also seen maybe a very slow decline in the number of patients hospitalized. It's not been as fast as we'd like. We feel sort of stuck a little bit on a plateau. Our positivity rate for testing is around 2%, which is about as low as it's been. But it's been stuck between 2 and 4 for quite a while. And so I think it really continues to point out the importance of getting vaccine out there and trying to answer questions for people who are vaccine hesitant. I think, when we start hearing news that there's more vaccine than there are people lined up to get it, that is a little bit disheartening when we understand what percentage of people have actually been vaccinated. And I think it's critical to the end of this pandemic. And the CDC recommendations today are a step in the right direction, but I think we're better off when everybody, or at least when nearly everybody, is vaccinated. And for both the individuals, most importantly, and for the public as a whole. And so I will stop talking and let's get to the questions.
Sounds great. Thank you all. So we have some really great questions that build off of what you all spoke to in your introduction about some of the changes that we've seen. And folks are particularly interested in the changes with the masks. So, Dr. K, you just talked about this in your introduction, but maybe we can dive in a little bit deeper. How do these new mask mandates affect schools?
As I mentioned, the masking mandates were just, or the new guidance was released today. So we are still working through to see how it affects every situation. And I also mentioned that we have to wait for our CDPH, or the State Department of Public Health, to update their guidance, and that is what we will follow. But my expectation is that, especially now that we are making vaccine available to those 12 and up, that there will be changes that will impact those age groups in terms of whether they're vaccinated or not, and whether they have to wear a mask in their classroom as well.
Great, thank you. So there are questions about, what you mentioned, Dr. Cohen, in your introduction, which is that there is more supply than demand at this time, and folks are wondering, how are we going to tackle vaccine hesitancy?
So I think forums like this are one way to try to address it. There are a number of things that are going on across the street at Davis, particularly reaching out to underserved communities. There's been a lot of work with farm workers and trying to get vaccine out, and mobile trucks, and a variety of different strategies. Since there are some people who can't take a day off to come and get a vaccine when vaccines are available. There are a lot of different things, but I think that one-on-one answering questions for people is very helpful. Not to come and try to push something, but we're going to be starting a clinical trial for those people who are vaccine hesitant, to do testing, and then ultimately get vaccinated after the period of time of testing, which I think is partially done to have people in contact. And so they're thinking about it all the time, and they start thinking about getting vaccinated. There's also compensation for it, which is another way to address vaccine hesitancy, I must say. And that's one of the strategies that is being considered. And this study is being supported by the National Institutes of Health. So it's something that's, I think, foremost in people's mind and trying to get things done. I can tell you that it's interesting. You know, we also are doing a clinical trial with the Novavax vaccine, and we opened our pediatric arm, and we had like 50 people sign up, and they've all canceled because now they can get EUA vaccine. So the people who are interested, they're gone, right? Those people, they disappear really quickly. They get vaccinated quickly now. And then the people who are hesitant, you can't get to them. So I think however you can do it, I just think that answering questions face to face and having members of the community who are there to support your comments are the ways to try to address this. Everyone's hesitancy is for a different reason. And I think a lot of the safety issues can partially be addressed by the fact that over 100 million people have been vaccinated, and we're not really seeing any real safety signals. So I think that, you know, it's, you can't really say, I'm just waiting to see what happens, because there have been so many vaccines delivered that we've seen what's happened. I'm going to stop. I can go on forever, and I don't want to take this too far.
And I did want to add to what Dr. Cohen has talked about. One of the strategies that we have found that has been very effective is working with community-based agencies to actually do the recruiting and registration of people, especially in the underserved communities, because they know their communities, they know where to find people. In some places, they've actually gone door to door to knock and get people registered, answer questions, call them up to make sure that they were going to make their appointment. So all of these things are very helpful in getting people to overcome either their hesitancy or to overcome their barriers. Some people are not getting vaccinated because of barriers they have, and those could be visible barriers such as transportation, or there could be others where they just don't feel like they can leave their neighborhood. So changing our strategy to be able to get vaccine into the communities, into smaller clinics, and again, working with community-based agencies to be able to do the outreach has been helpful. We're also looking at fun ways of being able to get people interested. Dr. Cohen talked a little bit about using incentives. So we're looking at how do we incentivize or get people interested in getting vaccinated. And we're hoping that soon we'll be able to tell you more about some of the plans that we have. We're still in discussions with many of our partners to see how to do it. The other also is to go to places that people are accustomed to going to, such as schools. And we've worked very closely with our school administrators, and especially now with the approval of Pfizer vaccine for ages 12 and up, being able to offer it in more of the schools. And when we have the school children come for their vaccination, we also get the adults at the same time. So we're trying as many ways as we can in order to get more people to get vaccinated.
Thank you, Dr. K. And so we have a community member that's wondering, you know, what is driving the flatlining of our numbers? And what will happen if we're not out of the red by June 15th? And there's a couple questions that are kind of related to this, right? Like the intersection with June 15th and the numbers, and what does that look like?
So when it gets to June 15th, regardless of where we're at, whether we make it to the orange or not, we will all, I guess, enter beyond the blueprint together, meaning that all the tiers will go away. So we will no longer be assigned to a certain color tier based on our case rate. And as I mentioned, any of the guidance that was sector-based for businesses, for example, restrictions on occupancy for restaurants, all of that will go away. What will remain, we know, is that there will still be some guidance for face coverings and masks, especially in certain settings. And then also there will be some guidance for especially the really large events, such as those that have more than 10,000 people. So we're still waiting for details of that. And then as for what is causing our flatlining, as you call it, or stagnation or plateauing, I think it's multiple factors. And in looking at the surrounding counties, we've seen that surrounding counties are also having the same phenomenon, in that their numbers are either not declining or might be slightly going up. And so we think it's more something regional that's going on, but I don't think it's one factor. We know that it is related to some gatherings. It is related to some youth sports. We have had some multiple small outbreaks that are related to youth sports. And we do have some concern about variants, because we do get reports about variants that have been identified within the neighboring counties or within Sacramento County. And some of them, as we know, tend to be more contagious. So I think all of those are factors that are contributing. But I think the way out of it, and which is the most important, is for us to make sure that we get as many people vaccinated as possible. Sacramento County is still lagging a little bit behind the state average in terms of number of doses. So we're working hard to get up to speed with that, and to get to the average at least, especially now since we have more doses available, that makes it easier. So it's just us being able to get the people who are willing to get vaccinated.
Great, thank you, Dr. K. And you know, there's actually this question that I think has come up in every session, which you touched on briefly, Dr. K, which is why is Sacramento one of only 9 counties still in red, asks one attendee, and why is our vaccination rate lower than other counties of approximately the same size within California, asks another attendee.
So I think I've answered the first question already as to why we are still in the red tier. As far as the vaccination rates, that's also multiple factors. If you recall at the beginning, when the vaccine was being rolled out, the prioritization was based on occupation. And so when we were rolling out a vaccine in Sacramento, we were vaccinating people who either lived in Sacramento or worked in Sacramento. So because Sacramento tends to be an employment hub, and we have a lot of people who work in Sacramento but live in surrounding counties, about 20% of our doses were actually going to people who lived in other counties but worked in Sacramento County. So I think in a way that put us behind a little bit. And of course that changed once we went to strictly age-based. So I think that did contribute. And then when you look overall, the counties that have the highest vaccine percentages, these tend to be the wealthier counties, such as Bay Area. And there are multiple factors related to that in terms of health equity and health access. And so that's one thing that we work with in public health, is trying to eliminate those disparities. So that's why we're working hard to be able to get people vaccinated so that we eliminate the gap.
Awesome. Thank you for that context. And, two of the things you brought up, Dr. K, in the past question were youth sports and variants. And so, Dr. Cohen, let's talk a little bit about variants. Is there any evidence that vaccines are significantly less effective against any of the specific variants?
Yeah, so let's start out with the variants that are circulating in California predominantly. And the biggest one here, at least the last time I looked at the data, is the one that started out in Great Britain called B1117. And that's the predominant strain. There's no evidence that the vaccines don't work equally well against that variant, but that is transmitted more readily. And so that may be part of the reason that we're not seeing as quickly of a decline as we would like in Sacramento. That's number one. Number two, the second most common strains are these so-called California variants. And there's also no evidence that the vaccines don't work equally well for those. I think for the strain that was seen in South Africa, which does not seem to have taken much of a foothold in the United States, because I don't think it's transmitted faster, is the vaccines don't work quite as well for that. There was just a publication in the New England Journal of Medicine on the data from the Novavax trial in South Africa, where it worked less well than it did in the study that it did in Great Britain. And so that we know. We also know that the antibody levels are lower for both the Pfizer and the Mrna vaccine. But the data on actual protection is limited, but even with the vaccines that don't work as well, people don't get as sick, and they're still not being hospitalized and not ending up in the ICU, right? So I think that's a critical component. The data on this B1617 that is causing so much difficulty in India, it's not really clear how that will work. It does have one of the mutations that may make the vaccines a little bit less effective. And so that is a possible issue. There was a study, I can't remember whether it was actually published in a peer-reviewed journal yet or not, but there was a study from Stanford that looked at people who had vaccine breakthroughs, and they did seem to have more infections with the California strains than with the strain that the vaccine was initially developed against. So it may make it a little bit less effective, but the key point is that people are not getting as sick. The amount of virus, when they quantitate how much virus is present in the people who get infected after they've been vaccinated, it's significantly less, which suggests that they can't transmit as effectively if they can transmit at all. I think there was a study in a nursing home that said that they didn't transmit if they broke through from the vaccine. So even if it doesn't totally prevent all the infections, it's unlikely to end up contributing significantly to the people who are in the hospital, and particularly those who are in the hospital in the ICU. Is that too long of an answer? I think it covers sort of what you were asking.
It absolutely does, and it covered about 5 questions. So that was a great answer. So thank you so much, Dr. Cohen. And the other one that you had talked about, Dr. K, was youth sports. So a community member said Sacramento County posted on Facebook that there has been a notable spread in youth sports. Can you provide more context for this, such as ages and spread, and if parents should pull their kids from youth sports?
Well, I think what's most important now that youth sports has been allowed is, one, if they are over the age of 12, that they make sure that their student gets vaccinated or their child gets vaccinated. That's one thing. The other is to follow the protocols that are in place, because there are ways in which they can minimize either the spread or even the risk of exposure, such as if somebody is exhibiting symptoms, even if they think that it is due to allergies, that they should be cautious about that and not go for the practice or not go to the game, because most of the cases that come to our attention, it is because somebody had mild symptoms and so they didn't think anything about it, but only to find out later on that it was COVID-19. So really important to follow those, and if you're sick, stay home. And also get vaccinated if you are over the age of 12. As far as the cases, the outbreaks we're getting, most of the outbreaks we're getting are really small. It's between 3 and 6 individuals. And so once those are identified, we have the team go on quarantine, and that does stop the spread. So we do have effective ways of stopping the spread. I think what's most important right now, especially with the availability of the vaccine, is to get it if you're eligible.
So that leads to a great follow-up question from Alice, who is wondering, what are we going to do about those students that are under the age of 12, and they may not be able to access a vaccine until fall?
So right now, the same protocols that we've had in terms of stay home if you're sick, symptom check before you go to school. I think those are all very effective. Hand washing is also still very effective. As I mentioned, we still have the masking mandate, and until that gets changed, I think we still have to follow that, especially for those populations that cannot get vaccinated.
So we are actually going to take a quick break and launch a poll. We have such a great number of folks who are attending at this moment, and we wanted to get a chance to get your feedback on this webinar and the space, and give us a sense of where we should go from here. So I'm going to launch a quick poll here. Okay, so you should be able to see the poll at the bottom of your screen, and it's going to ask you a couple questions like, what should we do about these community conversations moving forward? If we discontinue them, what would be the most helpful way in continuing to give you helpful information? And just some different feedback that we'd love to hear from you. So I'm going to keep this poll open for a couple minutes as we continue hearing your questions, and then we'll be able to actually show you the responses on the poll anonymously together. So we'll just let that go for a while and let folks respond to that. So we have a question about the mRNA vaccines. What more data or information does the CDC need in order to approve the mRNA vaccines? Has there been enough time and data available? And Dr. Cohen, if you are going to comment on this question, there is a specific attendee who wants to know, Dr. Cohen, please explain how the RNA in the vaccine works and then goes away.
Okay, so first, my understanding is that Pfizer is very close to asking for full approval of the vaccine, and that may come within the next month. So I think they've gotten to the point where they have collected enough data that they are just packaging it up and will submit it to the FDA. and I suspect, just as it was with the EUA, that Moderna will come right behind. And I noticed that within that question is also noted that some of the vaccine hesitancy may be that emergency use authorization doesn't totally make people feel like it's non-investigational vaccine any longer, even though it isn't, right? Because these are not studies that are being done. These are people being vaccinated. And so that may address some of the vaccine hesitancy, as I think the community member has suggested. As far as how the mRNA vaccines work, just to sort of describe it again, the mRNA vaccines are put in a little capsule of lipid, of fat, and that's injected, and that is taken up in the muscle where it's injected. And then the vaccine, the lipid releases the RNA into one of the muscle cells. And then once the muscle cell sees the RNA, it starts making spike protein, the target of the immune response for the coronavirus vaccine. And once it has made the proteins, then the normal action of the body is to degrade the RNA so it disappears. And then those spike proteins get right up to the surface of those muscle cells. And that's where the immune system sees the spike protein being presented to it on the muscle cell. So the RNA gets into the cell, it does its job, and then it sacrifices itself, right? I can't think of what insects they are, but once they mate, they die, right? This is the same idea, right? It makes the RNA makes the proteins, and then the body normally just cleans it up, gets rid of it. It doesn't need it anymore. Unlike my office, which is why I use a background for my Zoom meetings.
Great, thank you for that description. And the parallel to your office, I feel like that can really resonate for many people. So we have a question about travel. Why is it necessary for the fully vaccinated to wear masks on airplanes and public transportation? Is this really based on science?
Well, I can take a whack at that. I think the initial data were still, we know that some, as I mentioned, some people do get infected after they get vaccine, albeit a small number, and it still isn't 100% clear whether you could potentially transmit, even though the data appear more and more that you will not be able to transmit. But so I think it's just part of being very cautious, given the fact that on an airplane, it's not really clear whether everyone is vaccinated, right? All those CDC rules now say if everyone's vaccinated, you can go without a mask. But in an airplane, 6 feet separation is inconceivable. And so, so I think the fact that not everyone on the plane is vaccinated, they're asking people to wear masks, potentially to protect the other people, not to protect you. You're already protected with the vaccine.
Yeah, and to add on to that, I think it's just the fact that you're spending that many hours together in the same space. And as Dr. Cohen pointed out, you cannot maintain the 6 feet of separation. So it will take time unless you have a full flight where everybody is vaccinated. Maybe in those situations, they will not require the masking, but we're not there yet.
And what measures are needed if a fully vaccinated person is exposed to COVID?
So if a fully vaccinated person is exposed to COVID, they do not have to quarantine. And the reason for that is because they are protected by the vaccine and the risk is very low. So they can just continue about their daily business. Of course, if they do exhibit symptoms, then they do have to go and get tested and isolate if it turns out positive.
And one of our attendees is wondering if outdoor large-scale walks, and I would say maybe events too, will be able to resume in the fall.
Yes, as I mentioned, the state is working on some guidance for that, especially if the number is less than 10,000. And actually, we've received a number of requests to review plans for some of the event planners. And I think that they'll be able to have their events in the fall.
So what happens in the summer or the fall if we have a surge? Will Sacramento County be moving forward to reenact restrictions, even without the state blueprint?
That's a difficult question that I don't have all the answers to. I think that there is a lot more protection now, especially with the vaccine. And we've seen the evidence of that from our long-term care facilities. In previous times, whenever we had a surge, once it hit the long-term care facilities, we had really large outbreaks. But since we got the residents vaccinated, and some of them have 100% vaccination rates, we've seen very few cases from the long-term care facilities. And so my expectation is that we probably will still have some cases occurring. So we still have to do the contact investigation. And if there's an outbreak, deal with that outbreak. But I think the general thought is that with the effective vaccines that we have, that we will not require the kind of shutdowns at the scale that we did at the beginning of this pandemic, unless there is a drastic change in either the contagiousness or the, how the outcomes for the people who get sick. But right now, looking at the data, it appears that we will be able to use the regular methods that we have for controlling outbreaks, going business by business.
Got it. Thanks, Dr. Kay. So we'll just call folks' attention to the poll. We have about 79% of folks that have voted. So we'll keep it open for probably 2 or 3 more minutes for the last votes. Okay, so we have another question that relates to the June 15th timeline and the reopening rollout. Understanding that people living outside have a lower vaccination rate because of access, not hesitancy, than the general population, what is being done to ensure that reopening rollout does not disrupt the ongoing vaccine efforts? Displacement itself is a public health issue, especially in the heat of June. Is there anything being done to ensure people outside will be able to build on the timid stability of the last year in terms of sanitation and less displacement?
It helps if I unmute. Those are important points that you bring up about the homeless, because this is a vulnerable population. And because of the CDC guidance stating that as much as possible, we minimize movement of people who are unhoused or homeless, we were able to get more services to them. But I think moving forward, especially after our health officer order goes away, we need to look beyond that. We need to look at how we can continue to provide services. And I think this is really an effort or an issue that requires the entire community to come together to find solutions. It can't be done by just one agency. It can't be done just by government. And so that's why we have a group of people who are working on this and looking at ways of us, getting more people into housing. I also know that there's a lot of money that is coming down the pike, both from the state as well as from the federal government, to deal with the the issues of the unhoused or unstably housed individuals in our communities.
All right, thanks, Dr. K. So going back to the vaccine itself, has there been any further research or studies on the safety of the vaccine for women who are pregnant? Is the vaccine considered to be completely safe for women who are pregnant?
Yeah, there were just two small studies, I think just published today, on pregnant women and vaccine. First, the study did show that the side effects in pregnant women were no different than they were in any other women. These were both relatively small studies. One of them was 100 people, give or take a few, and the other one was around 85. So it wasn't a huge, neither of them were huge studies. But what they did show was that there were no fetal malformations. There were no changes actually in the placenta, and that the babies got antibodies. So they were presumably protected at the time of birth because they got immunity. As far as any other complications, there have been no other reports, nothing through the CDC vaccine networks where adverse effects are reported, called VAERS. And so I think it remains a safe vaccine for pregnancy, just like every other vaccine that is not a live virus vaccine.
Thanks, Dr. Cohen. So, when we're talking about getting the vaccine out to the diverse communities of Sacramento County, Dr. K, you mentioned some of the different barriers that may be in place for people to be able to access the vaccine. And there's a couple questions here, probably 5, that talk a little bit more about that. So just hoping we can talk a little bit more. We have a community member that said, in comparing percentage of Sacramento County ethnic groups with the percentage of those who have been vaccinated, the African American and Latino ethnic groups are underrepresented in being vaccinated in Sacramento County. And then there's also 1 or 2 questions about transportation barriers, and if we're going out to people, kind of where we are, what are we thinking about with mobile vaccination?
So with the mobile vaccination, we are both going out and having clinics in the communities, in churches, in schools, and at the same time, we are also, we have a collaboration with SAC-RT that offers free rides for people who need to get to a vaccine appointment if they can show their appointment card. So those are ways in which we are trying to work with the transportation barriers. Also, again, working with community-based agencies, we try to, if they're service providers, they're able to find out what the barriers are and how to make sure that those barriers are overcome. So those are ways in which we're trying to remove some of those barriers. Some of them are language barriers. And so for some of our clinics, for example, the one that we have at the Canal Center, we have people who speak different languages who are right there and are able to provide the assistance to people who have difficulty with registration, with filling out forms, or with language barriers. And so that's, again, one way that we try to work on that. You did mention about the underrepresentation of the Latino groups and the African Americans, and that is true. Part of that was because of the way that the vaccine was rolled out, where it was occupation-based, the priorities were occupation-based, and the occupations that we started off with had an underrepresentation of those communities. And now, even as we work towards eliminating those disparities, I think it's important for us to recognize that it's important to have people that are trusted, because there have been many people who have had unfortunate interactions with the medical community that have made them feel like they will not get the best care. And so being able to develop that trust, either by having people from those communities either assisting or being able to have opportunities to have scientists or medical professionals from those different communities that will address some of the issues, I think is important. And then also, of course, looking at the way that people get information. Many people are dependent on Facebook. And so if they're part of a group that is sharing conspiracy theories, they will tend to believe them because those are coming from their social network. And so making sure that we put accurate information out, and also make sure that we have people representative from those communities who can get to some of those conspiracy theories and misinformation and provide the accurate information.
All right, thank you, Dr. K. I know those were a lot of questions all in one, so appreciate you breaking them apart and talking about what Sac County Public Health is doing. So do we expect booster shots to become required?
I will assume that at some point in time, we're going to need another dose of coronavirus vaccine, not unlike what we talk about with flu. But I am honestly not anticipating that happening quickly. Maybe I'm being overly optimistic, but I'm thinking that we're finally getting our arms around it here in the United States, at very least, and I think that the boosters are going to be necessary to deal with whatever virus is circulating. So number one, if there are some variants, then the booster would have to be a little bit different than the one that you get now. But eventually the immunity is going to wane from this as well. And with the assumption that SARS-CoV-2 is going to be around for a while, I suspect we will need to be vaccinated again, even if it's with the exact same vaccine that we've received already. So yes, I expect there will be boosters. I don't know that any vaccines currently are required. And so, but I think that I'm looking in an optimistic way and thinking that it's not going to be, we're not going to be just thinking, I just got my first vaccine, I have to now line up again and do this all over again. I can't picture that. I'm just going to say, give it another year, maybe, maybe a little longer than that if things go well.
All right. So we have some questions from some community members about events and meetings. So Luann is wondering who controls rules for group meetings in places like our public libraries. And we also have some questions about different events. You know, if an event larger than 10,000 folks is going to be allowed, and being able to interpret the different guidelines around events.
So the blueprint comes with business sector guidance that is specific to certain businesses, is also specific to certain settings and events. So all of that information is included in the blueprint right now. And for example, depending on the tier in which a county is, there are different capacities that are allowable for especially indoor activities. As I mentioned, when we get to June 15th and the blueprint is retired, that will be at the point at which all of that will go away, and we will have some general guidance, for example, for especially larger events such as those larger than 10,000. But otherwise, just following the general guidance of, first of all, get vaccinated if you can. The other is using some of the protective measures that we've been using before. If you're sick, stay home, wash your hands. And I know that there have been some changes with guidance for masking, so we will see what that will look like on June 15th.
All right. And is California using all of its vaccines? And is Sacramento, and the question isn't that specific, but I'm thinking they're talking about all the different types of vaccines that are available potentially, as well as, the quantity.
So we've been able to do that pretty well until lately when we saw a drop off in the demand for vaccine. So each of the counties, when you look, they do have some additional vaccine that they have in stock, but we are trying to make sure that we use up our vaccine, and if we have excess, that we're able to send it to another place where it could be utilized.
All right. So we have a community member that's not sure how to interpret the CDC mask guidelines for mixed audience settings for vaccinated and non-vaccinated. For example, this person is going to church. Can they remove their masks since they don't know who is or isn't vaccinated and they are?
That's a good point. My advice is that if you are in a mixed gathering where you don't know the status of everybody, the vaccine status of everybody, that you take the cautious step and keep using the mask until we get to the point where our numbers are low enough that we can remove that masking mandate.
Got it. Well, I think this is a great time to end the poll. We're still continuing with the community conversation. I'm just ending the poll. We had 95% of people participate, which is really awesome. Let me go ahead and end that now. Great. And Zoom has a cool way where you can also just immediately share the results. So are you seeing the results? Okay. So we had 84% of folks who are interested in community conversations. 14% who said maybe. If we discontinue to have these, folks are interested in getting information by submitting their question to public health and getting it answered promptly, 38%. Another regular space to get updates on what's happening with COVID-19, 62%. A written update from county public health, 38%, and a verbal update, 18%. And then at what cadence you'd like to receive information, we have about equal amounts weekly, bi-weekly. And then any other needs you have, the 55% said access to answers from leadership, 36% said the online access is really helpful. So thank you so much for sharing that information. I'm going to stop sharing the results. And then there was somebody who mentioned they were not able to get access to the poll. I did create a separate little Survey Monkey just in case. The questions didn't encompass everything that you were interested in providing feedback on. So I'm going to go ahead and put that in the chat, and you can provide more qualitative feedback there as well. Okay, so we have a question about the cause of persistent symptoms in COVID-19 patients. Are there research protocols to study this phenomenon?
Boy, that took a little time to get it unmuted this time. I'm not sure what happened. So Yeah, there are studies that are being done. There are a number of institutions across the country that are looking at this in a multifactorial way. So pulmonary medicine people, infectious diseases people, rehab people, psychiatrists, other groups that are involved in not only figuring out what's going on, but trying to support people who are struggling with long-term effects of COVID-19. So there are data, you know, this isn't unusual insofar as there's a lot of evidence that people who get serious infections do have a long recovery phase. And it's not clear whether some of it is due to persistent lung damage that occurred with the COVID-19, or whether it's the immunologic response to the virus that hasn't totally shut off. I mean, there are a lot of questions that need to be answered and that are being looked into. But I would say that there are reports even back in 1919 about people who survived the 1918 flu pandemic with long-term chronic symptoms. And so this is something that I think people are aware of. It seems to be maybe a higher amount with COVID-19, but I think that probably is because there were a lot of people who were in ICUs and a lot of people who were seriously ill at the beginning. And it seems as if the people who were sicker are the people who are more likely, not the only people, but the ones that are more likely to end up with post-acute coronavirus syndrome, which is what it's being called now, PACS.
Got it. Thanks, Dr. Cohen. So Carol and Carla have questions about COVID-19 in general. So Carla wants to know about the recovery COVID cases and the survival rate. And Carol heard on the news that there were 1,400 new COVID cases. Where are these coming from? What age groups are involved? So I'll pull up the dashboard again, just so folks can get, you know, the landscape view of where things are going in COVID, and then if we have any responses to their questions.
So about the report, I'm not sure what they're referring to by 1,400. I think we would have to get the context for that in order to understand what they're talking about. In Sacramento County, we're getting about between 100 and 120 cases per day. And as you can see from our dashboard, and our case rate is 6.7. As far as where the cases are coming from, I think it's important to recognize that we still have the virus circulating in our community. So in certain settings, especially with gatherings, and if you have people that are susceptible, then those are opportunities for spread of the virus. I don't know if I answered all of the parts of that question.
Recovery case rate. So yeah.
Okay. So in general, we've looked at this, and it's about, and I'll flip that over. We have about 2% of cases in general that end up in death, and that's overall. But I want to point out that it's not the same for each age group. So if you look at individuals over the age of 65, it's like 13% of people who get COVID-19 that will, if they're over the age of 65, will end up dying. So that's pretty significant, and I think it's important for people to understand that, because there have been times where people will argue and say that, well, it's only 1% fatality, but especially also because of how quickly the virus spreads, because it's respiratory, even 1% is very significant, because if you are infecting over 1 million people, 1% can be quite a lot. And when you look at the death rates, especially now that we are looking back at 2020, you can see that there's excessive deaths that occurred in each of the age groups and each of the race ethnicities, and that excess death was due to COVID-19. And COVID-19 was the #3 cause of death. And actually at the beginning of this year, especially when we were seeing the surge in cases, it was the #1 at the beginning of this year. Fortunately, with the vaccine coming on, those numbers have gone down quite a bit. But I think sometimes when people are asking about, the fatality, it's important to look at all of the factors and not just look at one number.
Right. Just to re-emphasize that, right? There have been over 32 million cases in the United States. There are almost 600,000 deaths associated with COVID-19. That 1%, that's a lot of people, right? I don't know what the population is of the city of Sacramento itself, not the entire area, but it's bigger than the whole city. And so this is right. So don't get hung up on the percentages, right? This is a big number.
Yeah, it's again, it's important to look at in perspective and not just be hung up on one number, because there are always a lot of different factors that you need to look at. Also want to point out again, someone did ask about the long COVID or the post-COVID. What was the syndrome again, Dr. Cohen?
Post-acute coronavirus syndrome, PACS.
Right. Yeah. There are a lot of people who, even after they recover from COVID, do not go back to their pre-COVID health. We have many people who have gone home, been discharged on oxygen, many who continue to have fatigue, many who are not even able to walk. And we haven't even gotten the count of all of the people who have been impacted by COVID-19.
Great. Thank you. So, Dr. K, I think you've probably said this once or twice, but it's a hot topic, and there may be folks popping in and out of the conversation. So we'll go over it again. To talking about the change in come June 15th. Folks are wondering, Karen has a question about why do the tiers even matter anymore when the CDC is releasing this new mask information? Are we going to drop mask mandates? And will all public health orders be lifted on June 15th, or are any health regulations remaining after that you foresee? So just kind of all tying into the changes that are happening now and poised to happen in a month. You're muted.
Helps to unmute. The tiers were developed at the time after we were coming out of the shutdown, and it was a way for us to be able to have a method for making decisions on the restrictions for the different businesses and business sectors, as well as how to reopen carefully and slowly so that we wouldn't end up with another surge. Yes, I think that, it's been a long time, and that is why the state has been looking at, okay, we need to move on to something else, especially now that we have the vaccine available. So we just have a few more weeks of the tier, and after June 15th, all of that will go away. As far as what's going to remain, there will still be some guidance as far as masks, and definitely that looks like that's going to be different from what we have right now. especially as the numbers continue to go down, and especially as we have more and more people vaccinated. So yes, we are slowly getting to recovery. And we've said this many times that we now have a light at the end of the tunnel. But it's still important for each of us to do our part. It's still important for each of us to get vaccinated, because that's how the community will get to the immunity level that we need.
Got it. Thank you. So, those two questions, and then this is, I think, the last question about June 15th. So we talked about the mask mandates, and you talked a little bit about what that might look like, and how the county is following the state orders. And so we're kind of waiting to see what happens with CDPH around their changes. And so in terms of the question around, are any health regulations remaining after June 15th that you can foresee?
Our health order will be terminated at that point, as the state orders also are terminated. So we will just be following the guidance from the state.
I think that ties nicely to another question about someone wondering if there's any advice for businesses who are trying to continue keeping up with all these changes. Businesses will have no idea who's vaccinated or who's not, and trying to keep up with all the changing rules.
Absolutely. It's been difficult, especially in this last month when there have been so many changes and so frequently. I think the best is to look on the state website. They do have a summary document that talks about what the guidance is for each tier. So looking at that, we also have a team at the county where if you could send in your questions, or if you want to call, we've been able to help the different businesses understand what they need to do in each situation.
Great, and I'm go ahead and I'm putting that email address here in the chat. So for folks who have some of those follow-up questions. For a vaccinated 17-year-old with mild asthma, is it safe to regularly sing and act with 10 other performers indoors on stage without a mask?
Well, the question is, do we know the vaccine status of those other individuals? If we don't, my suggestion is you continue to follow the guidance, wear a mask, and maintain the 6 feet of separation.
The recent flu season was extremely cold. Will the county recommend that we all don masks next flu season?
I think that would be difficult to continue. This past flu season was very mild, and that's because we had all the preventive measures in place in terms of face covering, in terms of avoiding gatherings, and also 6 feet of separation. But I think we will not do that, at least for the general public, unless we have a very severe flu season. I think these measures can only be maintained for a period of time. And the good thing for the flu is we do have a flu vaccine, so I highly, highly recommend that you get vaccinated for the flu once the flu season starts. I don't know if Dr. Cohen has anything that he'd like to add to that.
Yeah, just from a non-public health point of view, I think the masking showed two things, right? One is that flu is not as transmissible as SARS-CoV-2 is, because when we were wearing masks, we were not seeing any cases of flu. I can't think of how many patients that we actually admitted to the hospital with influenza. It's got to be one hand's worth that you can count it on. And so I think it really does work. And I think, even if it's not mandated, it might be not the worst idea in big crowded areas when flu activity is up, to think about wearing a mask. I think it's, I mean, I know everyone's getting sick of it, but you don't have to wear it all the time. It would be if you were going into an event that, right, an indoor event with a lot of people and there's flu circulating around, why not add the protection? But it's going to be a personal choice. I think, right, I'm starting to think that that may be my new outfit for flying on airplanes. Right, just not sure. It did demonstrate that we can stop the spread of a lot of stuff by doing this.
All right. Well, something to consider for your outfit choices moving forward, folks, is a nice mask.
Just got to match your clothes, right?
Exactly. Exactly. So I've heard some people are skipping their second shot. Is one enough?
You know, it's not really. So there is protection with one dose of the vaccine. It's not as good. I think I thought I saw something the other day that quoted a number, but since I can't really totally remember it, I'm not going to say it, but it's less. And most of the cases that we've seen at UCD relating to people who've been vaccinated have been between the first and second dose. So I think it will make it less, but it won't make it as low as if you get both doses of vaccine. It was chosen, right? I mean, the two doses were chosen because that gives you an optimal, or at least a reasonably optimal antibody response that you didn't necessarily get with one. The other thing is that probably the length of time that you would be protected is going to also shrink if you only get one dose of vaccine.
Yes, and at the county, we have looked at those numbers because we were asked that question. I think there's a study that came out from the CDC indicating that about 8% of people were not getting their second dose. So we looked at our numbers, and the definition we made for missed second dose was somebody who got either Pfizer or Moderna and was beyond the 6-week period from the first dose. And that's what we considered a missed dose. And when we looked at our numbers in Sacramento County, it was about 6% in general. And we did do a deeper dive to look at who those people were who didn't get their second dose. And a large percentage of them were actually people over the age of 65. So what we've done is actually have our staff start reaching out to them to find out the reason for missing the second dose. Was it illness? Was it lack of transportation? Was it not knowing how to get registered for the second dose, or not even knowing that they had to get a second dose? So all of those are factors that could contribute to some people not getting it. So just doing the outreach and reminding people that it's important to get the second dose. And actually, we've been telling people that one dose is better than, I mean, two dose, how did we say it? One dose is better than nothing, but two doses are even better. So if you can get one, that's good. But if you can get the second dose, that protects you even more.
Got it. And in terms of that accessibility, how far are we from having vaccine available in our doctor's office?
Sorry, what? I don't quite get that question.
This community member is wondering if they can go to their doctor to get the vaccine, go directly to their provider.
I could start it off. Many of the providers do have the vaccine available, but not every provider. So I think the important thing would be to call first and find out if your provider is carrying the vaccine. And if they are, then yes, go ahead and get it there.
Yeah, I don't think there's anything that precludes a community doc from having the vaccine, other than the fact that they need a freezer, right? That'll be at least -20, which is a regular freezer for the Mrna vaccine. I suspect that there are not a lot of local docs that are going to carry Pfizer because you need to have an ultra cold freezer. I think that was part of the interest with the J&J vaccine was that it doesn't really even need freezing, and so it would make it much more easily spread throughout the community. And for those who are still interested in getting the J&J vaccine, I suspect that that would be something that community docs could much more easily have than the others. Because you really need, right, they need a freezer that actually monitors the temperature, right, to make sure that it actually stays at -20. And a lot of frost-free freezers, they warm up transiently. That's how it stays frost-free. And so it has to, when it goes through those cycles, it still has to be held at -20.
Got it. So we'll take, our last two questions here. Will employers mandate the vaccine?
At this point, I'm not aware of any employer that is mandating it.
Yeah, we're having a lot of conversations in the whole University of California system as to whether vaccines will be required or not. I suspect that more likely than not, what's going to end up happening is that people are going to be, that you're going to be mandated to participate in the program, but then you'll be able to decline vaccine. But that's just a guess.
Okay, and
I'm not a lawyer, right? That's where the lawyers come in, you know?
There you go. We'll have to bring a lawyer out to the next call. So we have one more question, which I think this is a great one because we actually haven't talked about testing that much today as a part of the conversation. So, Trina mentioned that a lot of people are looking to fly and they need tests. And so, folks are interested about what is, should we continue to get tested moving forward and what does that look like? We also have some testing resources available through Sac County Public Health. Yeah, Dr. K, do you have any thoughts on that?
Yes, absolutely, especially if you are going to fly, yes, to certain places, especially outside of the United States, or if you're returning, you might be required to get tested. And then also, if you are exhibiting symptoms, definitely. And there might be some other additional circumstances, especially if you are in a congregate setting where you might need to continue getting tested on a regular basis. Youth sports does require testing, especially before the vaccine was readily available to youths. Probably that's going to change with time, but right now there are some circumstances where testing is still required or recommended.
Great, thank you. And I went ahead and put the link to our free community testing sites that run Monday through Saturday. Should folks have an interest in getting tested, free testing. So we are out of time. I went ahead and put the email address for COVID-19 vaccine at saccounty.net if you didn't get your question answered or if you have any follow-up questions. Dr. K, Dr. Cohen, any concluding remarks for our community members?
Well, just thank you for participating, and we appreciate you taking the time to ask the questions and listen to us. And we continue to hope that these conversations are useful to you.
Yeah, I would second that. We really appreciate the participation the thoughtfulness of the questions. Right, I think that it's really a good conversation, and hopefully people are getting the answers they want. And based on the poll results, it suggests that people are, right? The idea that people want to keep this going also tells us that we're probably doing the right thing. I always wonder, right? I'm sort of an odd guy out in this thing, so I always wonder whether I am or not. But I appreciate the fact that people are really um, being helped by this, and again, just keep asking good questions.
All righty, thank you. And we got about 10 or so thank yous that were submitted into the Q&A just now from all sorts of people. And Holly, we have about 100 or so people that attend most of our community conversations. Okay, well, I hope everybody has a fabulous night. And